You are lying there, and the second it starts to hurt, your brain makes a calculation. Do I say something and ruin this? Or do I just breathe through it and pretend everything is fine? So you smile, you make the right sounds. You perform your way through pain because somewhere along the line, you learn that your body's job is to cooperate. And when it does not, when it locks up or burns or feels like it is tearing, you do not blame the situation. You blame yourself. You think you are broken. You think you are failing at something you are supposed to just know how to do. This is not about anatomy lessons or clinical terms. This is about why you feel like you are failing a test you never agreed to take. Here is what actually happens when sex hurts. Your body is not betraying you, it is protecting you. Painful sex, dyspareunia, has real physical causes that doctors love to dismiss. Pelvic floor dysfunction means the muscles that support your pelvic organs are too tight or too weak. Endometriosis means tissue that should only line your uterus grows elsewhere and bleeds internally. Vaginismus is when your pelvic floor muscles involuntarily contract, making penetration painful or impossible. Hormonal shifts, especially after childbirth or during menopause, thin vaginal tissue and kill natural lubrication. Vulvodynia is chronic pain around the vulva with no obvious cause. These are not rare. They are common. And yet, when you tell a doctor it hurts, they say just relax, or have a glass of wine like your nervous system is something you can override with willpower. The diagnostic gap exists because women's pain has been undertreated and under-researched for decades. Your suffering gets reframed as anxiety, as being in your head, as something you need to manage emotionally instead of something that needs actual medical intervention. So you leave the appointment thinking the problem is you. But here is what is really happening. Chronic pain rewires your nervous system. Your body has an alarm system designed to protect you from harm. When you experience pain during sex repeatedly, your brain starts treating intimacy as a threat. It is not a conscious choice, it is a survival reflex. Your nervous system flags penetration as danger, and your pelvic floor responds by tightening to keep the threat out. This is your body doing its job. The disconnect happens because your conscious mind says yes. You want intimacy, you want connection. You want to feel normal, but your pelvic floor has learned a different lesson. It learned that this activity causes harm, so it locks down in defense. You cannot talk your way out of a reflex. You cannot willpower your way through an involuntary muscle response. Telling someone with vaginismus to just relax is like telling someone having a panic attack to calm down. The system is already activated. The body is already in protection mode. And here is the part that makes you feel like you are losing your mind. The more you try to push through it, the worse it gets. Forcing yourself to endure pain does not teach your body that sex is safe. It teaches your body that sex equals danger, and next time, the muscles lock down even faster. You are not broken. You are not defective. Your anatomy is not rejecting you. Your body is trying to keep you safe from something it has learned to fear. The shame comes from the belief that your body should just work, that other women do not have this problem. That if you were normal, you would be able to function sexually without thinking about it. But painful sex is not a personal failure. It is a medical condition with physical causes that need actual treatment, not reassurance that you are overthinking it. If any of this is hitting home, drop a comment. Even just saying helps someone else feel less alone. Here is the part that broke my brain when I first learned it. Your body is reacting to pain before the pain even happens. Not metaphorically. Literally, the moment you think about sex, your pelvic floor is already contracting. Your muscles are tightening, your breathing is getting shallow. All of this happens before touch, before penetration, sometimes even before you are in the same room as your partner. This is anticipatory tension, and it is the real reason why just relax is such useless advice. Your body is not waiting for your permission. It is already in defense mode. Let me show you how fast this happens. A woman I know described it like this. She would be getting ready for a date night, putting on makeup, feeling good, and then her stomach would drop, not because she did not want intimacy, But because her body had learned to associate the idea of sex with pain, by the time she was in bed, her pelvic floor was already locked down. She had not even been touched yet, but her nervous system had already decided this was a threat. That is not anxiety you can talk yourself out of. That is a reflex. Here is the cycle. You experienced pain during sex. Your brain recorded that pain as a threat. Now, when you anticipate sex, your nervous system activates the same protective response. Your pelvic floor muscles contract to prevent penetration. That contraction makes penetration more painful. The increased pain reinforces your brain's belief that sex is dangerous. Next time your body reacts even faster. The cycle feeds itself. This is a feedback loop, and it is vicious. Fear of pain creates muscle tension. Muscle tension creates more pain. More pain reinforces the fear. Your pelvic floor becomes a fortress you cannot consciously unlock. You can tell yourself to relax 1,000 times, but your body is not listening to your thoughts. It is listening to the pattern it has learned. And that pattern says, "This hurts, so we are shutting it down." Here is the revelation that changes everything. This cycle is not happening because you are doing something wrong. It is happening because your nervous system is doing something right. It is protecting you from harm. The problem is not that your body is broken. The problem is that your body learned the wrong lesson, and now it is applying that lesson perfectly. Once you understand that, the whole game changes. The performance anxiety makes it worse. You know your body is not cooperating. You know your partner might notice. You know this is supposed to be easy, natural, something you should not have to think about. So now you are not just dealing with physical pain. You are dealing with the pressure to be normal, to not ruin the moment, to prove you are not broken. That pressure activates your stress response, which tightens your muscles even more. You are fighting your own body while trying to perform intimacy, and it is exhausting. Then there is the identity crisis. When your body won't cooperate, you start to feel like you are failing at being a woman. Like there is some fundamental part of you that is malfunctioning. You watch other people talk about sex like it is effortless, and you wonder what is wrong with you. Why can you not just do this? Why does your body reject something that is supposed to be natural? The shame is not just about the pain. It is about what the pain means, that you are defective, that you are less than, that you are letting everyone down. Your partner's reaction adds another layer. Maybe they are frustrated. Maybe they are confused. Maybe they are trying to be understanding, but you can see the disappointment. Now you are not just managing your own pain. You are managing their feelings too. You are apologizing for your body. You are trying to fix something you do not know how to fix. The pressure to make it work, to not let them down, to prove you are trying hard enough, that pressure becomes another thing your nervous system has to process, another threat, another reason to tighten up. And here is the trap. When people tell you to just push through it, they are making it permanent. Every time you force yourself through pain, you are teaching your body that this is what sex feels like. You are reinforcing the neural pathway that says penetration equals harm. Your pelvic floor learns to brace harder. Your nervous system learns to activate faster. Pushing through does not desensitize you. It sensitizes you. It makes the protective response stronger, faster, more automatic. You are not building tolerance. You are building trauma. Your body is not malfunctioning. It is doing exactly what it is designed to do when it senses a threat. The problem is not that you are broken. The problem is that your nervous system learned the wrong lesson, and now you need to teach it something different. That starts with stopping the performance. You do not owe anyone access to your body, especially when that access causes you harm. This is not about being selfish. This is not about withholding intimacy. This is about recognizing that your physical safety matters more than someone else's experience. The belief that you have to endure pain to be a good partner is a lie. It is a lie that keeps you trapped in a cycle that makes the pain worse. Communication is not the end of intimacy, it is medicine. Honesty about pain is the first step toward healing. When you say this hurts, you are not ruining the moment. You are giving your body permission to stop bracing for impact. You are breaking the pattern that says you have to suffer in silence. Your partner might be uncomfortable hearing it. They might not know how to respond. But their discomfort is not more important than your pain. Here's what most people get wrong. They think the goal is pain-free sex. But the actual goal is pain-free intimacy. Penetration is not the only way to connect. It is not the only way to experience pleasure. It is not the measure of whether you are succeeding at intimacy. Expanding what counts as connection, touch that does not trigger your protective response, pleasure that does not require your body to override its alarm system, that is how you start rebuilding trust with your own nervous system. Pelvic floor therapy is a game changer. Physical therapy can retrain your muscles to stop treating touch as danger. A pelvic floor therapist teaches your body that it is safe to relax. They work with the involuntary responses your conscious mind cannot control. This is not about stretching or forcing. It is about teaching your nervous system a new pattern. One where intimacy does not equal harm. The timeline is not linear. Some days you will feel progress. Some days you will feel like you are back at the beginning. Healing does not mean fix forever. It means learning to listen to your body instead of overriding it. It means recognizing when your nervous system is activated and giving yourself permission to stop. Progress is not measured by how much pain you can tolerate. It is measured by how safe your body feels. The radical act is prioritizing your physical safety over someone else's experience. Stop performing. Stop pretending it does not hurt. Stop apologizing for your body's protective response. You are not failing. You are surviving. And survival is the first step toward healing. Your worth is not measured by your ability to endure pain in silence. The first step is admitting the performance is killing you. Drop a comment if this landed. Sometimes knowing you are not alone changes everything.